of the Peterson Garrison. Ladies and gentlemen, partners on our bases, welcome to February. We're in a new month, but still in the middle of a pandemic. Good news is things are improving in our community. We're engaged with the mayor, we're engaged with the community, we're tracking closely to make sure we adjust our posture accordingly. Some also good news, we received some vaccines in January and have started to vaccinate across our bases. I'm here today at the Med Group to provide you some more information on vaccines, on our way ahead, and answer your questions about those vaccines. With me today are Colonel Patrick Pohle, our Med Group Commander, and Dr. TJ Coker, Chief of Medical Staff. They look forward to sharing some information with you and answering your questions.
Hello, I am Colonel Patrick Pohle. I'm the 21st Medical Group Commander. And I just want to say thank you to Colonel Smith for his introduction and frankly for his support as we've been fighting through this pandemic. With me, of course, is Dr. TJ Coker. He is my Chief of the Medical Staff and my top subject matter expert regarding everything medical, from vaccines to research on the disease itself. What we're trying to do today is kick off what I hope will be a series of recurring town halls, even if we have to do them virtually, where we can connect with beneficiaries and answer common questions that we get. The primary topic that we want to hit today is, as you might imagine, COVID-19 related. Specifically, we have some questions to answer about the vaccine, and we would like to offer some information about the vaccine's efficacy and its safety. Once we do that, I do have a few additional medical topics that I'd like to introduce to you as well to give you an idea of where we might be able to take these town halls into the future. So thank you for being with us today, and with that, we'll go ahead and get started. Okay, so first of all, I'm going to look to Dr. Coker to answer some of the questions that we got from the community. So Dr. Coker, if you're ready. All right, so we'll roll right into this. So the first question we received, and by the way, thank you for sending these questions in. When can high-risk personnel on base expect to receive the vaccine?
That is an excellent question, and at this point, we don't have a good firm timeline. We're anticipating maybe March and April timeframe. Right now, the rollout and logistics of the vaccine supply is very limited, and we right now are moving through the DoD schema, and based on the supplies that we're getting so far, it may take us a while to get to that population. Right now, our priority has been the first responders on base, the medical personnel, and some of the critical national security people who work on this base across the garrison. But as soon as we get ample supply, everything that we are doing now and developing in our processes are so that we can launch this into a larger effort to hit all those high-risk populations as soon as possible.
All right, thank you, Dr. Coker. So moving on to the next question that we received. And this question has to do with PCSing, personnel movement, and that sort of thing. And it reads like this. I am trying to find some general information about members PCSing here to Peterson from another Air Force base. With all the information, it is hard to narrow down an answer as to what are the requirements for someone PCSing here to Peterson. Is there any quarantine required, or is that dependent on what base travel is conducted from? I really appreciate any information. So if we could share some answers to that as well, Dr. Coker.
Yeah, so right now, Peterson, Schriever, Cheyenne Mountain does not have a firm policy about restriction of movement or quarantine on arrival here at Peterson and Schriever or Cheyenne Mountain. Really, the goal is to push that to commanders to make that decision. Major Timberlake and myself developed a tool that commanders can use to determine a risk assessment of where that member is coming, where they touched, what points they touched along the way, to determine whether they need to have that restriction of movement when they arrive here. Part of it is we want to protect the people already in place here in Colorado Springs, and so that restriction of movement is really a force protection decision, and really goes back to the commander to make that decision. We are available for first serves and commanders to reach out to us for any of those inbound questions. We can provide the tool that we provided, and they can help with those decision making.
So for the next question then, and this falls again to this idea of which special categories are getting vaccinated. In Colorado's vaccine distribution roadmap, 1B3 includes, quote unquote, specialized transportation staff. Does that include base operations and weather personnel? Over to you.
So right now, that 1B3 is looking at more at transportation workers. So these are people who are driving buses or other vehicles of public transportation. It's not specifically for base ops or weather personnel.
And then once the vaccination supply lines really start to open up for us, what will be the main course of contact when I know that it's my turn to become vaccinated? How will that happen?
That's a great question. Right now, we're developing different plans for each different phase. As we go through the different phases, we're tailoring the way that we're going to contact that population and bring them in. For example, as we look at moving into the population of members who have medical conditions, we're looking at sending out mailers to them and developing a process that they can book once they receive that mailer. And then as we get to a broader supply of vaccines, we're going to go ahead and do wide announcements and how people can do that and get signed up for the vaccine.
And this kind of falls along those same lines. Assuming you know the base personnel numbers, is there a roadmap or plan for the entire base? So maybe we can talk through a little bit of the schema and how that flows and who comes next.
Yeah, so right now the DoD has pushed out a schema, basically the priority of vaccinations for each base population. Overall, we have a rough estimate of how many people are on this base based on our influenza vaccine numbers. And so we're using that as one of the gauges that we're looking at different populations. We have done a survey of all the other tenant units on the garrison. So we have a rough estimate of those additional personnel. But we're going to use a combination of both that and the flu numbers to make sure that we have an adequate supply to get to that the endpoint of everyone vaccinated.
And this is where we start to get into some of the specific numbers and how we address this. How many vaccines have been currently administered? How many are expected in the new shipment and when?
So unfortunately, that is an OPSEC type of question. Right now, we're not allowed to advertise how many vaccines we've delivered. I can say that the volume that we're getting is significantly less than the community vaccination programs. But every single dose that we get, we are utilizing within 48 hours, and we're making sure that we're having zero waste of any of those doses. And so in the shipments right now, we don't have much foresight on what it looks like. We're looking at about a week in advance. And so hopefully as the next couple of months progress, we'll get better situational awareness of what's coming to us and how many doses are.
Thank you, Dr. Coker. And please support me in this and correct me if I'm wrong. When we're looking at overall numbers in terms of who needs to be vaccinated, numbers of vaccines and all these things, what we can tell you right now is that there is more demand than we have capacity. And it comes back to the supply system. We are still waiting for the supply system to really turn on full force. We are told that that is coming. We are told that the producers of these vaccines are increasing their production as we head into the spring and summer months. So the hope is that right now we'll transition from where we are, which is having more demand than vaccine capacity, and moving to a scenario where we have more vaccines than we know what to do with. So that is what we're hoping for by spring or summertime. Any further thoughts on that, Dr. Coker, or is that pretty well covered that?
Yeah, it covers that, sir. I just think one of the goals for us is really to try to get 80% of our beneficiaries vaccinated by 4th of July. And so that's really our goal. As we look at like how we process our people at this point, we're always looking at how we scale it up so we can push these out faster. So it's a very lofty goal, but we feel like we can meet it as soon as the supply of the vaccine is there. And hopefully we can get that there and get things back to a little bit more normal than it is now.
Perfect, perfect. And in addition to just numbers, the whole how many do we have, when can I get mine, those types of questions. The other types of questions we get a lot here at the medical group have to do with, is it effective and how safe is it? And I know you've done some great work in outreach and sharing our encouragement that people do go ahead and get this vaccine. Can you share some basic background information then regarding the vaccine itself as it relates to COVID and the pandemic?
Yes, sir. So right now we're receiving the Moderna COVID-19 vaccine. It has given an emergency use authorization by the FDA. It has a significant amount of evidence behind it. It just, unfortunately for vaccines, they do need 1 to 2 years to really flush out all the benefits and risks with it. But due to the immediate benefits seen in the study, the FDA has granted that authorization in light of the pandemic situation. In the initial study, it's been shown to be 94.1% effective in preventing symptomatic COVID-19 infections. The other beneficial part of it is anybody who received the vaccine, none of them had developed severe COVID infection. This is defined as someone who needs to go to the hospital, someone who's in the ICU, or someone needing oxygen. They got the vaccine, they may still get COVID-19 infection, but it won't be as severe as if they didn't have the vaccine. So those are very reassuring numbers. In terms of side effects and adverse events, in general, most people have mild vaccine-related illnesses. So typically the symptoms that people reported were body aches, fevers, fatigue, muscle aches, and kind of pain at the location of the vaccine site. And those are common symptoms with them. Most of them improve in a couple of days. Most of them don't need any medical care whatsoever. And right now, that seems to be the majority of the symptoms that people are having with it. And while there are a few reports of severe events, they're extremely low, and they're still trying to be flushed out exactly whether they're tied to the vaccine or not.
Okay, so one final question related to the COVID-19 vaccine that we get on a pretty regular basis is, what if I'm a GS or I'm a contractor, yet I work these same mission areas as my active duty counterparts? Am I eligible to receive the vaccine? In addition, what if I'm a retiree, I'm empaneled here, but no longer working necessarily for the government or working in a position that's not part of one of these mission critical capabilities per the schema? Can I get my vaccine through your medical group as well? Dr. Coker?
Yeah, so if you're a part of the garrison units on base here, the different facilities, you as a GS and contractor, you are authorized to get the vaccine during your slot time. Now the only caveat that is, if you should develop any side effects or adverse events from that, we will not cover or provide care for those items. You'll have to go seek care off base with your regular insurance company, but we can provide that vaccine based on whatever group you are. Now, retirees, definitely the goal is to cover all beneficiaries in the local area eventually. It may be a while before we get to you if you're not tied to one of the mission critical areas, but they are a priority. Based on the flow of vaccines, unfortunately, I suspect that most of our retirees should be able to get the vaccine easier off base initially than on base, but hopefully we hope the supply chain will catch up that we can provide that to all our beneficiaries.
Okay, now that we've spoken a little bit about COVID-19 and its associated vaccine, what I wanted to do is cover a few topics that might give a little bit of an idea of where I would like to take these virtual town halls, or if we're able to do a face-to-face town hall at some point, into the future. So I have a few questions here that we get on a pretty regular basis that I thought I'd offer up for this forum. And the first one is, if we have a snow delay or a closure based on weather, what happens to my appointment and how do I get rescheduled? Well, what I can first start out with is our status as a medical group. The 21st Medical Group is an outpatient clinic. We don't have the type of services that would require us to be considered mission essential personnel. For example, if we had an inpatient facility or we had our own emergency room, we would have to be on 24/7 operations. We are not in that status. So for safety reasons, what we do if there's a delay or closure is our medical group follows the same procedures as other units on base. So if there's a delay, we delay. If there's a closure, we close as well. So hopefully that's pretty clear as a foundation for what I'm about to say. So then what happens to your appointment? Well, if we have a closure, your appointment is canceled. But our personnel here in the medical group may make a phone call to our central appointing line. And then the central appointing line knows the status of our treatment facility. so that they can start reaching out and making contact with you as a patient to offer a rescheduled appointment. They will make the attempt first, and if they're unable to contact you, they'll try to leave a voicemail, and then they give us a list of folks that they were able to get in contact with and folks they weren't able to get in contact with. And then our clinics take over from there to try to get those appointments rescheduled for you. But by all means, if you know that because of a delay or a closure that your appointment has been canceled, please feel free to go ahead and reach out to our appointment line, or you can always try our TRICARE Online option to try to reschedule your appointment through that route as well. So as a follow-up question regarding delays or closures, we have our point of testing operations for COVID testing. And obviously in those scenarios, those services would be impacted as well. Dr. Coker, can you step us a little bit through how that might work?
Yes. So if you have an appointment to get tested, whether it's because you're having symptoms or it's a mission-related testing, if there's a delay a snow delay, essentially your appointment will be moved back to match that snow delay. In addition, if the base is closed that day, testing will be closed. Part of this is the concern is for safety for our staff. Since it is a drive-through testing lane, we want to make sure that the weather conditions are safe for them to do the test. And by doing the delay to match the base posture will allow us to clear the area before testing begins.
Perfect, thank you. Another topic that I wanted to bring up for your awareness is military construction with our military treatment facilities. If you have visited the Peterson campus or the Schriever campus recently, you have probably noticed quite a bit of construction going on. That's right, both of our locations have construction to remodel our facilities. At Schriever, the remodel really at this point isn't impacting the services we deliver themselves. But come the summertime, we're going to have the opportunity to expand those services into a much larger facility. So I think that's going to be a relatively seamless transition because we're going to simply be expanding instead of doing major movements from section to section. It doesn't mean there won't be some of those movements, but I think that situation will be somewhat more straightforward and transparent to you as a patient. However, if you receive your care from the Peterson campus, you will notice that at the earlier part of January, we made quite the transition. So our main entrance is completely shut down now. In fact, the former patient parking is now a parking area for our construction crews. And they're using that main entrance as their primary means of entering and exiting the building, which means we have had to move our primary entrance to effectively the other side of our facility. So if you come into our facility to park, we have signage to show you where patient parking is versus staff parking. From there, it should be a relatively easy walk to our entry control point. So what you look for is what appears to be a little guard shack or shed. That is your primary way to enter the facility. Once you get to that entry control point, our folks that are there are really good at, first of all, screening for possible COVID symptoms. That's their primary reason for being. But they're also very helpful in terms of directing people to the right building, because we effectively have two buildings now. One, a temporary facility for patient care, and the other one is still within our main facility. Once you're inside those facilities, we have placed large yellow signs to direct people to the appropriate place to go, because we know things have changed. My own staff is still learning their way around. I'm still learning my way around, but we're getting there. And certainly if you're in our facilities and you need some help finding your way, please don't hesitate to reach out. We'll get you pointed in the right direction. All right, a final topic that I just wanted to mention today, and this is more of really an advertisement for something called the Military Health System Nurse Advice Line. This is a resource that I personally think is underutilized, but I think it's absolutely fantastic. The Nurse Advice Line gives the opportunity for individuals, beneficiaries in the military health system, to reach out when needed for medical advice from a registered nurse. When might you use something like this? Well, it's 24/7, but I think of it in terms of after hours, weekends, if you're traveling and you develop some sort of medical issue and you're not sure where to go. A lot of folks, when they develop a medical issue, they jump on Facebook or they contact a family member and they try to get advice, when really what they want is to talk to a medical professional. The nurse advice line allows that. I can tell you from my own experience that I had my family camping one weekend. One of my family members developed a medical issue, and since we were camping, we weren't really familiar with the area. We didn't know where to go. So we were able to call and speak with a nurse, run over the list of symptoms. They were able to give us advice and give us approval to go to a local facility to get some help. I think it's absolutely a fantastic resource available to any of our beneficiaries who need it. We will make sure to put some links for you so that you can have easy access to those numbers. But please, if you need some medical advice, keep in mind the nurse advice line. It's a wonderful resource. Well, thank you so much for joining us today. We hope that this has afforded an opportunity for you to ask questions of us and for us to provide some answers to you. As I mentioned before, we hope this will be the first of a recurring series of town halls, whether virtual or face-to-face, where we can continue this dialogue. Our hope is to be as transparent as possible with our beneficiary population to get you the services and support that you need. With that, and on behalf of Dr. Coker, I wish you well, and thank you again for joining us.